Hi, everyone. It's Dr. Tim Brown. I'm your host for PharmCast for the community. Thanks again for joining us. As you guys know, we've been talking with different healthcare professionals, everything that we can think of with COVID-19 and what's going on to help keep you informed. Today, I have Dr. Suzanne Lester. She's a physician in town, assistant professor with the AU-UGA Medical Partnership, and also maintains a practice here at Athens at the Piedmont facility. Good morning, or how are you doing, Dr. Lester?
I'm well. How are you?
Doing well. As I mentioned coming into this, physician here in town, working at Piedmont, also assistant professor at the partnership. But I also know that you are also running a mobile clinic in town. Tell me a bit about your background. Where are you from? What have you done? And what's your specialty, if you will?
Gotcha. So I have a long list of Southern roots, but was raised in New England and then trained on the West Coast at UC San Francisco after being a UC Berkeley undergraduate. So technically I actually went to UC Berkeley UCSF joint medical program. And out there's definitely an emphasis on social determinants of health and care for the underserved built into the curriculum. And I trained in family medicine at a UCSF affiliate about an hour north of the Bay in Santa Rosa, where many of our patients were migrant workers working in agriculture and vineyards, actually.
Nice. So family medicine, taking care of the entire family with a focus on those that maybe don't have great access to health care.
Yep.
So with that said, I know that you're also teaching at the partnership as well. What are some of the things that you're dealing with the medical students there?
So as a little bit more background, my first job here was at the Athens Neighborhood Health Center, which was not then, but is now a federally qualified health center. And then when I started teaching at the med school, I was part-time teaching clinical skills and community population health teams. And then eventually I took over the family medicine clerkship. Well, started it. I was the first one for our campus and still run that in the third year. And then I took over the community population health curriculum after a couple of years co-directing clinical skills and embedded a mobile clinic aspect to it. So you can kind of think of it as like a continuity clinic on wheels where students are assigned to different neighborhoods and they spend 1 to 2 half days a month there over the course of 2 years delivering mobile primary care to underserved, uninsured communities.
So this mobile unit that you brought in for the students and for yourself to go out, has its role expanded during this pandemic and dealing with this virus?
So it's expanded and shrunk in a way. So we're currently only doing telemedicine for the primary care portion of it. And we have instead transitioned into doing mobile COVID-19 testing in those same neighborhoods where we already are established as a regular kind of partner or fixture in those communities.
So those neighborhoods, those communities, tell me about the patients that are there or the people that you get a chance to run into and help out.
So they are all low income, so typically under 200% of the federal poverty line, under or uninsured. Most are actually, despite stereotypes, actually most are working poor, and many are of mixed documentation status, meaning that they're immigrant families where maybe the parents weren't born in the US, but the children have been, or the younger children have been, the older children have not. Workers in poultry, agriculture, manufacturing, and then kind of physical plant or household type things like house cleaners, janitors at the school district, or bus drivers, things like that. So very kind of blue collar.
Right. So going in this population, you're bringing healthcare to them versus them trying to find their way to healthcare since they all work and sometimes can't make time for appointments. Tell me about this testing, because I swear every time I turn the news on, there's something new about testing and where does it happen. So in Athens, when you've added this layer, if you will, what do you do to test for this virus? What does that look like? I have no clue. Even how do you even figure out if you've been exposed or not?
Right. And so thankfully the restrictions have loosened up. So right now the mandate is we can test anyone and everyone who, whether they're asymptomatic, have been exposed or not, because at this point with community spread, everyone is at risk. Initially it was symptomatic and it can be very mild, or people who lived in congregate settings, which in our view, crowded housing developments, crowded apartment buildings, crowded trailer parks would count as a congregate setting, as well as a jail, a dormitory, a skilled nursing facility, things like that. People who are 6 year older, people who are living or taken care of, people who are 6 year older in their household, healthcare workers, first responders, et cetera, et cetera. But now it's open to anyone. So what we do is we have a hotline established that the medical students volunteer to staff, and it's a remote hotline, so they don't have to report in anywhere. It just channels the calls to their personal cell phones, but always looks like our mobile clinic number. And they answer calls and they get name, address, demographic information. There's a Department of Public Health standard form that we use. And at the end of the day, we get a report, and it has a map and a list of addresses. And then I plot the map out, and then I start calling patients and saying, hey, these are the days that we're going to be out doing door-to-door testing. Are you going to be home? What time is best for you? And then we try to map a route where we're not crisscrossing across town. And so we'll do that. We pull up, we call them from the van and say, we're out front. And then we go to their doorstep. We don't go inside any homes because that increases our exposure risk. Outside is much safer. And we'll test them on their porch, their patio, their driveway, whatever. And then the other thing that we do is we have gotten calls from community partners specifically saying, we know we're high risk. For example, all of our people in the neighborhood are still having to go to work. They don't have protections in place. Can you come do mass testing in our area? Here's a place where you can set up. And usually it's a place where we have set up in the past to do primary care. And so they'll make flyers, we'll put signs out, and then we'll go to those neighborhoods and just post up and set up tables and tents. And then we'll do essentially what is drive-through testing or walk-up testing. But it's within their neighborhood. So if they have a car, we'll have them drive through because it contains people from each other. It maintains that 6 foot distance. But we'll have them bring their entire household in their car so we can test everybody immediately around them.
I see. So basically you can call the 800 number, what's that number, by the way?
It's 706-308-4092 is the mobile clinic, our Athens Free Clinic mobile clinic testing.
That's the local number to call. And then also you have people who sort of say, hey, we have a population that would like to get tested. Can you come to our neighborhood or our church or whatever it may be?
Exactly.
So you're excuse the term spreading in this viral component we talk about. I should use the word spread, should I? But it sounds like what you're doing is getting out to the public and sort of bringing health care to them, if you will. That
has always been our goal because I was involved. I've had a working group that was working towards a multidisciplinary mobile clinic for 8 years ago. Eventually, we realized we needed a needs assessment that would incorporate transportation questions and also just trying to figure out what domains of need people had. And we were able to hook up with the group that was doing the 2015 Community Health Needs Assessment for Athens, Clarke County, St. Mary's, and at the time it was called Athens Regional, now Piedmont Athens Regional catchment area. And it included questions about food insecurity, legal concerns, financial concerns, safe environment, domestic and interpersonal violence, transportation, childcare, all sorts of things. And those got mapped into something called the Athens Wellbeing Project Atlas, which maps it down to the elementary school zone based on need. We are one of the poorest counties of our size in the country. And so now we were able to identify specifically which neighborhoods, number one, didn't have access to nearby walking distance healthcare or bus route healthcare on their bus route, who also identified cars as being a challenge. And so that way we knew that we could go to those neighborhoods and we would just bring it to them. And then we also try to go at times of day where they'll be home.
Right. So I like this idea as well as getting out and also doing preventive care. I know that right now you're focusing on testing, and it's great that the students are doing the hotline and helping to do all those things and route it. You know, I guess the question would be, though, if I were listening to this podcast and I didn't necessarily fall into one of those categories and I still want to get tested, are there other places in Clarke County to go get tested, or are there places that people should look up, I guess, to find a testing center. How do you do that?
So, Department of Public Health does all of their testing for free. You don't need insurance, but you can have insurance. So there is an Athens drive-through site, which we're not allowed to give the address, but it's on the west side. And what you do is you call their hotline, which is 706-340-0996. They'll do a brief screening. They'll get your demographic information in, and they'll give you a time to show up, and then they give you the address. And then you do drive-through testing there. At this point, most of the urgent cares, the emergency rooms, and some private offices have test kits that they can also do. It's the acute testing. This is not the antibody testing.
This is just a rule. This is to see if you've been exposed or not, right?
Or if you have virus essentially in your nose or oropharynx at the moment.
Right. And that's what's confusing, I think, to a lot of people is exactly all the different testing that's coming out. Which one do I get and all those things. This is the one that just tells you if you have virus present.
Now. Yep.
Right now. And how quickly do the test results come back no matter where you have them? So what's the turnaround time?
At DPH, so for example, today is May 11th. And the test results that I have, still not all of them, the most recent results I have are from April 30th.
So about 2 weeks.
Yes, it was supposed to be 24 to 48 hours, but because of then the expanding mandate that more people could get tested, the lab that the state has contracted with, I believe, has gotten overwhelmed. And so they can't seem to catch up. And then we do have a couple of results from May 2nd, but mostly we're still working on April 30th. So it's 7 to 10 days. We do all of our own, both we and DPH do all of the positive resulting. So they call and I call, and then I call all of the negatives as well.
I understand. So people understand that when they get the test, it's not going to be in this society where we get what we want immediately. We have to wait a little while and then make sure that we wear a mask and stay away from folks and until we get that result back, right?
Right. And so that's what's complicated. So for example, if you're in the emergency room or you're a health employee at Piedmont, you can get the test that takes a half a day to turn around. If you're insured or willing to pay more money out of pocket, you can get one that's pretty much a 24 to 48 hour turnaround at most of the urgent cares. They're rolling out antibody testing. Again, that's with qualifiers that are to say, this will just tell you if you've had it. It doesn't tell you if you're immune. And what we're telling everybody, the hard thing is that because so many people now we can test asymptomatic people, is that telling them to self-isolate based on the fact that they felt the need to get a test no longer really applies, right? Because they're asymptomatic. But what we do is we tell everybody, wear a mask. Wearing a mask protects others from you and your asymptomatic viral shedding.
Right.
Yeah.
So, I mean, I think that's the thing. Everybody's been talking about masks. Should you do it? It was interesting. I was out running errands this weekend and buying groceries, and about 70% of the store had a mask on and about 30% didn't. So, wearing a mask protects not only you, but it protects those around you. It's you breathing on others, which we all do every day.
Right.
Yeah. So I think the other thing that really has been driving me a bit crazy is we're really focusing on the virus as we should. It's caused a huge amount of change in our lives and a huge amount of health issues for a lot of people. However, I'm also hearing that a lot of people aren't doing their regular health care. They aren't going to their regular visits. What's the message on that? Being a family medicine physician, I know people are focusing on trying to stay in, but I'm worried a bit about folks not getting their vaccines or not getting their diabetes checks. What's going on with that?
So there's definitely been a decline in patients seeking their usual health maintenance visits. And at least in Athens, Clarke County, all children can get vaccinated for free here. And if they have insurance, it runs through insurance. If they don't have insurance, it's free. And typically, even with insurance, it's not like somebody's having to pay a direct cost for the vaccine. But so people are choosing to not go in because they don't want their child exposed. What they don't realize is that most offices at this point are doing phone screening first. And anyone with respiratory symptoms, any of the more recently identified symptoms like anosmia, dysgeusia, things relating to taste and smell, abdominal pain, which now we know may be related, rashes that we know can be related to COVID-19. All of those people stay in their cars usually, so that they are not going to be in the waiting room with children who are there for a well visit. And so I wish that people understood that and would know that it should be safe for you to take your kid in for their visits. And then the adults who are at most risk for vaccine preventable illnesses and bad outcomes are those who are also at the highest risk for bad outcomes with COVID-19. So it's hard. That's a harder counseling to do. But most offices at this point no one wants their patients to get COVID from their office, right?
Right.
So they have strategies in place to help keep the patients safe. So at this point, I would say no one should be missing a maintenance type of visit or a prevention type of visit where they could be getting vaccines, because we're concerned right now that we could see a resurgence, specifically pertussis and measles would be the ones that we worry about.
Whooping cough, in other words, right? The whooping cough. Well, interesting you point that out, because talking to folks that work in family medicine, you can go to a diabetes visit using your computer or telephone these days.
Right.
So, if you don't need a vaccine, you can still keep your diabetes visit or your blood pressure visit or whatever. And that really does help with your maintenance of your health.
It's true. And so and we're doing lots of telephone refills and all that kind of stuff. And what's interesting is I think we're going to find out that some of the health maintenance or chronic disease management that we've been doing, that we actually have been overdoing it and making people come in too often, because we could actually probably let them go out 6 months instead of quarterly.
3 months, yeah. And also now with telehealth too, it opens up. Now people have access using, their phone or whatever it may be, which is nice.
Yes.
I'm speaking with Dr. Suzanne Lester, who is an assistant professor at the Medical Partnership here in Athens, also a family medicine physician, and director of the mobile clinic that we've been talking about testing in the various neighborhoods of Athens. So Dr. Lester, as we end our time together, we've talked about a lot. You have 3 pearls you want to leave the community with regard to what we've talked about today?
Oh, goodness, no pressure. So I would say masks. Please wear your mask. Please socially distance. Stay outside. Outside seems to be safer. There's a lot more, it's a lower concentration of viral particles when it's dispersed into kind of infinite space. Make sure that if your children or you are due for preventative visits, such as vaccine related or important screening tests, then I think it's really important to keep those visits. And then finally, I would say that there's a really good analogy for why masks matter. And it's that if there's a man walking around without pants on and he pees on you and you don't have pants on, you get wet. If you put pants on, your pants get wet. If he put pants on, only his pants get wet. So everybody needs to wear pants, just like everybody needs to wear masks.
Exactly.
So it's a little
fashionable. Coordinate your mask with your pants.
Exactly. But it really, it matters. And I don't actually think it's oppressive. I think that it's freeing, because you can know that you are doing the right thing by your neighbor when you step out of your house with your mask on. So.
Wonderful. Thank you, Dr. Lester. I've been speaking with Dr. Suzanne Lester, family medicine physician here in town and also director of a mobile clinic. Thanks for your time, and thanks for all you're doing for the community with the testing and getting out there to those folks so they can get health care. We appreciate it.
My pleasure.